Welcome to Ask Sid, the official podcast for Sydenham Clinic. Today I come to you from our flagship location here in Beverly Hills. I am so thrilled to bring different guests onto the podcast so that we can talk more about our 7 pillars of health, and we can go deeper into your genomics, your gut health, your hormones, your sleep, your nutrition, psychology and physiology. So let's bring it on. Welcome back to Ask Sid, the Sydenham Clinic official podcast. And as you know, we get you the latest, greatest physicians in town to have conversations around medicine, longevity, beauty. And today we have a very special guest, Dr. Robert Dorfman. If you've ever heard Done by Dorfman, that's him. Welcome to the show. Thank you.
Thank you so much for having me. The space is gorgeous and it's an honor to be here.
No, we're excited. We're excited to be in your city. We're excited to partner with you, the great work you do. So before we start, I'd love to ask you the first question about, you are a trained surgeon, but now you're like the most famous doctor in town for injectables. How did that happen?
Yeah, so my journey, I completely unexpected. I was a fellow. I was doing surgeries as part of the fellowship. And as you know, in medicine, when you're a fellow resident, you don't make anything, right? You barely make ends meet. And the surgeon I was working for is a very famous surgeon, very talented surgeon, but not a good injector. And, his actually head of operations, my first week in fellowship, was like, hey, do you know how to do Botox? And I was like, yeah, of course I know how to do Botox. And she's like, can you do it for me? She said, just don't tell him, he's going to get offended that I didn't ask him, but just, I'll do it from the side and I'll pay you some cash on the side. And I was like, all right, sure, I'll do it for you. I did her Botox. She paid me $500 and she's like, best Botox of my life. And I was like, this is awesome, because I would make that was like my half of my week's salary in like 10 minutes. And I was like, this is great. And then a week later, she's like, can you do it for my friend? And I was like, yeah, sure. I did it for a friend. Her friend paid me $500. She's like, can you do lip filler? I was like, yeah, sure. I did her lip filler. She paid me another $500. And I was like, this is awesome. In like 10 minutes, I made my entire week's salary. And her friend was like, best work of my life. And she sent me another friend. And I was like, okay, this is great. I'll start DMing friends on Instagram. It was a little side hustle. I would do surgery 6 to 6, and then 7 to 10, I would message friends on Instagram like, hey, you want any Botox? You want any filler? 6 months into fellowship, I was so booked out. Like, I would do my little evening clinic 7 to 10. I was booked for weeks. I was making more money than what he was going to pay me to be a full-time surgeon after fellowship. I had signed a contract with him to move to New York. I was supposed to move. And it just got to the point where I was making way more in those 3 hours than I was going to make working 12 hours. And I would have even stayed. It wasn't even for that, but there was other reasons. I wanted to launch a skincare and hair care product company, and that's something I've been working on for almost a decade. And there were some issues with that in terms of the partnership, and that's what ultimately led me to leave. It wasn't anything else, and more that I wanted to kind of pursue our products, which I genuinely believe are some of the best products for skin and hair ever made. And it's something that I use not only on my face and my hair, but I've used them for years. And it's completely changed my life. So that was the reason I kind of left. And I found accidentally that there was this really big gap in the market where there's a lot of surgeons, a lot of plastic surgeons who are great surgeons, but they're terrible injectors, right? They're doing 10 rhinoplasties a day, maybe one Botox patient, right? And their nurses are excellent injectors, but many don't have the in-depth surgical and anatomical knowledge that that the surgeons do. And there's this kind of gap between a lot of these surgeons who don't know what they're doing, a lot of nurses who do know what they're doing. And there's not a lot of physician specialists in this area.
Especially surgeon specialists. The amount of training you have as a surgeon obviously gives you a whole different anatomical perspective when you're injecting.
Well, it's crazy because, I've seen the inside of people's faces, right? I've seen the inside of their bodies. And what I say is sometimes when I'm injecting, I can even by touch feel the layers, and I know exactly where I am. And it's like, I can't explain it. It's only something that if you've scrubbed into surgeries and you've been in surgeries, you would understand that when the needle goes in, there's almost this kind of three-dimensional knowledge of the face that you learn that you wouldn't have if you're not a surgeon. And I think that makes me an even better injector. That's why I genuinely think I'm amazing at what I do, is because I have that in-depth knowledge and I have that ability to understand all vectors of the face and of the body. It's not just in the face. Whether I'm doing the butt treatments or body treatments, you have that in-depth anatomical knowledge, and I think that's helped me exponentially.
But imagine parents telling their kids, go to med school, go study surgery, and then become an injector? Do you think it's going to become like a thing?
I think it's the future. I think if you look statistically, it's very obvious. The answer is very clear. The number of surgeries is dwindling and the number of non-surgical is going like this. And as technology gets, I mean, think about this. In the 1990s, right? Cardiac surgeons were flying private jets. They were making millions of dollars of surgery. It was the hottest thing, cracking people's chests. Do we even do that anymore? No. Rarely, right? Only for really severe advanced cases. Right. Cardiac surgery is a dying field. They tell you in residency, don't go do it. Why? Because we're doing it all through the cath lab, all minimally invasive, non-invasive. We don't crack people, very, very rare.
Or you do what we do at Sydenham. You prevent it.
You prevent so my whole brand is about prevention. I tell people, I started doing treatments on my face when I was 24. Everyone was laughing at me, like, oh, Dorfman's getting his Botox or using his moisturizer.
Yeah.
Now, my friends are jealous. They're begging me. They're begging me to jump because they've seen over the past 10 years, they look like crap and I look the same. I haven't aged.
So let's jump right in.
Yeah.
From a prevention point of view and then from a beauty enhancement point of view. Let's just go like head to toe because I know you do a lot of non-surgical treatments for breast enhancement, butt enhancement, in addition to being the god of injectables here in Beverly Hills. So can you tell us from a prevention point of view, like what are some of the things that you do and what are some of the things that you've pioneered in your practice?
Yeah, so, and I give this example, and this is the most important thing I tell to patients, is that think of the cancer analogy, right? Do you wait until you have stage 4 cancer and then start treating it? No, why do we do cancer screening? Why do you exist, this clinic exists?
Why do we do genomics?
Exactly. You want to catch it at stage 1, right? You want to prevent that problem from happening in the first place. Why would you let your face get to stage 4? Right? Why don't you want to let your face catch it at stage 1 and reverse it, right? What is the old school mindset? I'm just going to let myself go and then do a facelift and this giant CO2 laser and that's it. That is so outdated.
Totally.
That is totally outdated. We want to start early and prevent the problem. Same thing with hair transplant, right? The old mindset used to be, let yourself go bald and then do a transplant. That's the worst thing you could do. The best thing to do is start early, prevent the hair loss from happening in the first place, get on the right medication therapy, do the right treatments. I did that for myself, and I can tell you everything I tell patients is something, it's my own personal journey. I've been through this myself. I know what it's like to go through it. And
so let's start from the hair.
Yeah.
What are some of the things that you do for the hair, and let's go down.
So hair can be as simple as taking a pill a day, or just like even like every man I say should be on minoxidil. There's like no reason not to be on it. It will save your hair. It will prevent further hair loss, and it will grow new hair. And there's barely any side effects. I understand when people don't want to take the finasteride or gestrate. There's some sexual side effects with that. But yes. But the minoxidil, there's a no-brainer. You can do that. We can do stem cell treatments. We can do exosome treatments. We have hair lasers. You can do PDRN, which is a lot of Asian data to show that that's really good for hair.
What is PDRN?
Salmon DNA. So that's
You inject that in the hair?
You can microneedle or inject it. And they actually, we met the CEO of Regeron, who's Regeron is the biggest salmon DNA company in the world. And he was sending me a lot of studies now coming from Korea where they're using that for hair restoration. So that's a newer thing.
For women, I guess, like, because we don't really get on finasteride and stuff like that.
Well, women can be on finasteride. They just don't know. Yeah, my mother's on finasteride. My grandmother's on finasteride. I don't put anyone who's before menopause on finasteride because of the fact that it can cause birth defects. So I say, if you're postmenopausal, you should absolutely be on finasteride, or actually dutasteride is the better version. Minoxidil is a no-brainer. Traditionally, the problem with minoxidil is that it can cause hair growth everywhere.
Right.
But now there are creams that you can do that will eliminate any unwanted hair. So we can even eradicate that side effect. So it's one of those things that, again, minoxidil, it's as simple as taking a little pill a day that can radically improve your hair. And then, look, I have a lot of patients who don't want to take pills, and that's fine too. Then we have things like stem cells, exosomes, PRP, which can be, I think also can work as well, but it's a little painful. And the PDRN, which is great too.
Now comes the face. What are some of the things you suggest for prevention on the face?
My favorite thing is laser. I love lasers. I think, and I like injectables too. More natural injectables. You can do things like baby Botox, right? And everything is dose dependent. I tell people all the time, everyone thinks they're gonna do Botox, they're gonna be frozen and do crazy.
There's a lot of myth around that. I mean, there's some surgeons who feel that Botox can actually harm you in the long run. And what are your views on that? from a longevity perspective?
Everything in life and in medicine is about the dose, right? So I always say in medicine, there's something called the therapeutic index. There's a point at which a medicine can become a poison. And the best example of this is something called Tylenol, right? Like we all take Tylenol, right? Everyone's taking Tylenol. But do you know Tylenol is one of the top ways people commit suicide in the United States?
No, I didn't know.
So yeah, it's if you take
I know I was told it's a lot in the news. It's very controversial right now.
So if you take 20 Tylenol pills, that's going to cause massive liver failure. You're going to die. That's a very common way that people kill themselves. So how could it be that a medication that's so beneficial that we all take is also a lethal poison? It's that concept of the therapeutic index where even too much of a good thing can become a bad thing. That goes for everything in life. That goes for Botox, that goes for fillers, that goes for lasers. If you do a little bit of baby Botox in the right dose, in the right places, it prevents wrinkles from happening in the first place. I was at dinner 2 nights ago with my family. My cousin's 23 years old. I'm way older than he is. And I have less wrinkles than he does. And I was looking at him, I'm like, dude, you got to start. I'm like, I have less wrinkles than he does. And I was like showing him. And I'm like, it's all about prevention. Do not let your face get to stage 4. Start early. Do light treatments, baby treatments. You don't have to go blast your face with 60 years. And I know this
What about fillers? Like, are fillers preventive in any way possible? Do they age you?
No, but again, it's dose dependent, right? So filler, I always say, is like salt. And I love speaking in metaphors. You're going to learn this about me.
I love it.
Filler is like salt. And everyone's like, doctor, what are you talking about? If you cook with too much salt, the food's not going to taste good, right? It's going to taste salty. But if you cook with no salt, it's also not going to taste too good, right? So it has to be just right. I had a patient in Miami recently. We have a location there. And actually, her friend introduced me. She called me crying, saying that she went to some plastic surgeon. The plastic surgeon convinced her to put 8 syringes of filler in her cheeks. 8, 4 per side. And she spent $8,000. This girl's 22 years old. She didn't even have the $8,000 as a college student in debt. She went into debt to pay $8,000 for 8 syringes. I never put 8 syringes in anyone's face ever, like ever, let alone in a girl who's 22. She looked like a monster. I had to dissolve everything. That can harm you, right? That's terrible.
Right.
But if you put a 0.1 in 0.1, that's not going to harm you, right? That can lift and look excellent. It's all about also the quality of the filler, right? Not all fillers created equal. Everyone says, oh, filler as if it's the same thing. Filler has a property called G prime, right? G prime is the ability of a filler to stretch and recoil, right? Lip filler, under eye filler, those are low G prime, right? They're soft. They have to be able to match the softness of the lips and the softness of the under eyes. High G prime filler is sharp like bone. It's hard, it's rigid, right? So if I put hard filler in your lips, it's not going to look too good, right? If I put soft filler in your cheeks, it's also not going to look too good. It's all about using the right filler that's not going to move for the right location. So there's so many factors that go into the decisions that I make when I sit down with a patient. It's what are their goals? First of all, the most important thing is understanding them, right? I take at least an hour per patient. I sit with every single patient. I want to understand. I hand them the mirror. I say, when you look in the mirror, what do you wish was better? I want to get to know when they look in the mirror, what do they see that they don't like? Because it's not about what I think looks good. It's about what they think looks good. Because when they look in the mirror and they're like, damn, I look amazing. I feel amazing. That's hot. That's sexy. That's what we're trying to achieve. It has nothing to do with what I think. And it's funny, you go to a lot of plastic surgeons here and they're telling you what they think. And they create this look that they like.
Yeah, there's a whole Beverly Hills look.
That's out. That's outdated. That's not what this is about. Aesthetics is about looking, but more importantly, feeling amazing. It's about waking up in the mirror, looking in the mirror and saying, damn, I feel amazing. That's what I deliver at my clinic. And that stems from what's going on in your head. And the only way to know that is to sit with the patient and really understand I have to be a psychologist. I have to understand what are their insecurities? What don't you like about yourself? Because if I can fix that for you, that's the most powerful thing you can do for someone.
What about feeding into their insecurity?
That's
and
the
taking
worst.
Things too far. Like, how do you convince them otherwise? Because I mean, you're getting monetary benefit out of it. A lot of people around here feed into their insecurities.
That's the worst thing you can do. And I'll tell you, I've shadowed a lot of surgeons, worked for a lot of surgeons. I remember I'd go in these clinics and some of these surgeons would make their patients feel like crap, right? What's a technique that a lot of people do is they'll break you down. They'll say, point out how ugly you are, how bad these things are. That is the worst thing you could do for someone. I don't like doing that. I never do that. I always tell my patients, I'll be like, oh my God, like, you're beautiful, but there are things that we can make better, right? And you should never make a person feel horrible about themselves. I think that's like the worst thing you could ever do. And I never allow anyone in my clinic, whether it's me or my providers, to ever talk to a person like that. No one deserves to feel that way.
Right.
You want to take someone and say like, hey, every person is beautiful, right? But there's things that maybe that they don't like that they want to enhance to make them even more beautiful. And that's what my job is, to take someone and make them feel their absolute best.
You also want them to age gracefully and beautifully, right? It's not about looking really great in your 20s and then you botch your face for 30 and 40.
It's about, that's also why a lot of the work that I do is very regenerative. And that's why I said, that's why we're the future.
Yes.
I'm not thinking about what's hot now. I'm thinking about 30 years from now.
Yeah.
I think, look, there's going to be a need for some big surgeries here and there, but I'm thinking about people are going to start anti-aging early. They're going to start in their 20s, and we're just not going to age as much. We're going to prevent, and it's going to, we're going to come in, we're going to do these, the tech is only getting better with AI, with everything. We're just at the start of a revolution.
Absolutely.
And if you can help people do things like very regenerative, right? Like I love the treatments that are natural, the Salmon PDRN, the exosomes, the stem cell therapies. These are things that are going to make you look better with lasers. My clinic is a vast majority that. It's very, you know, fillers only when needed.
Okay, what about the breasts?
So I'd say the breast is interesting. Again, everything comes down to the right patient and the right patient selection, right? So a lot of patients now, I'll tell you how, for me, what's interesting.
Okay.
I dated a girl, and this girl was stunning. And I remember every time she'd take her clothes off, she had these giant, horrible scars from a breast reduction that she had. And they were awful. And she was so insecure about them. And she told me she wished she had never done the surgery. And I remember that stuck with me. And that was like, a lot of girls don't even understand there's a lot of other options out there besides having giant, horrible scars, right? Scars are permanent and they're for life. And I always think before you rush to do something that's going to be permanent for life, try the other stuff.
So you can do breast reduction without surgery?
You can do breast lifting necessarily without surgery, right? And again, that's what I tell you, everything depends on the case. I'm not saying that we're going to get rid of breast reduction. For the right person who's having really bad back pain, that's a choice that you have to make, right? It can be an amazing surgery for people who are suffering, but it can also be the wrong choice for people. And the importance that we have to do as physicians is educate patients and provide them with all the alternatives, right? A lot of people don't know that you can do RF microneedling on the breast, which helps tighten the skin and can also be great for breast lifting. There's a lot of really cool stuff that we can do that is changing. For example, I'll give you another example. Guy came to me actually literally last week, and he was very happy. He had come to me a month prior. He had this big vascular lesion on his face, giant vascular lesion that kind of grew. It's like a hemangioma. And he went to his dermatologist and they tried cryoablating. It didn't work. They tried another ablation procedure. Didn't work. They told him, you got to go to a plastic surgeon. You got to get it cut out. You're going to have a scar on your face.
Oh.
He didn't know what to do. His friend said, just go see Dr. Dorfman. It was a mutual friend. So he came to my clinic, and he didn't want to have a giant scar right in the middle of his face. I mean, that's pretty bad, right? That's permanent. That's for life. You're never getting rid of that. And I was like, you know what? Let's try injecting a sclera into there. A sclera is a thing that you can inject into a vessel that will sclerose the vessel. And I was like, look, what's the worst that's going to happen? Something bad happens, you're going to get it cut out anyway. You're going to get the surgery anyway, right? So how much worse could it be? I was like, why don't we try it? Worst case scenario, you're going to get it cut out, and then we know that that's the right option. We did the sclera injection. This has actually not been reported ever in the medical literature. We're going to write this up and we're going to publish it. I injected a sclera into his face, into these vascular lesions. The lesion is completely gone.
Wow.
Completely gone. We did it two, one in his forehead, one in his cheek. Completely gone. He called me crying. He's like, he could not believe what we were able to achieve without a single incision, no scars, nothing on his face. I changed this man's life with one injection.
That is amazing that how good non-surgical options are getting.
It's getting better every single year. That's what I'm saying. I'm looking at this in the future and thinking, this is just the peak. I mean, we have AI now. There's a company right now called Open Evidence that I think is fascinating, where they're taking, the problem with ChatGPT is it draws from everything. It draws from the good and the bad, the publications and the random websites. This new company, Open Evidence, is basically PubMed with AI. It takes every study, every publication, every scientific piece of literature that's ever been done, and it then can use AI to harness answers from that knowledge. So you're only drawing from the best source. I mean, think about how powerful.
You have to be a physician to log in. Like it asks for your NPI number to log in. Yes.
But think about how powerful that's going to be. Because when I used to do research, that was the hardest part, is understanding the background, the literature search. Imagine now, in 10 seconds, any question you want to answer is going to be drawn upon from all the publications in history.
Exciting.
How crazy is that? This is a
Exciting.
crazy time for to be alive.
Right. Okay. So as far as the breasts are concerned, you do breast augmentation with filler. And is there any other way that you augment? I mean, you did say you do some lasers and skin tightening that helps in lifting.
Correct. So for augmentation, you can do fat transfer too. That's a great option as well. Everything again comes down to the right patient selection, so that's a great option. The best thing that we're doing right now, the most popular procedure I'd say, is we're doing the butts. That's what
I was going to come to that. Like really.
People love that procedure. That is like, I mean, like.
And what is trending now butt-wise? Like, the butt trend has also changed in the last few years.
Definitely. So I like very natural. We like athletic, we like toned. We don't like that crazy BBL, giant. That's not our look. I don't like that. I'm not a fan. I prefer more timeless, elegant, classy. But there's nothing more feminine than a beautiful butt. And I tell people, watch the movie The Substance with Demi Moore. And this is such an interesting movie because it talks about the importance of youth in Hollywood. And the movie basically is about Demi Moore. She's in her 50s or 60s, and she was this pop star her whole life, or TV star. Now she's kind of aged out of Hollywood, and they kind of kick her off her show, and she feels ugly, and she can take this substance that magically turns her into the young, sexy version of herself. And what's interesting in that movie is when they contrast the old Demi Moore to the young, hot, sexy Demi Moore, there's two body parts that they show, the lips and the butt. All throughout the movie, that's all they're showing. There's a scene of her with her thin little lips, and then all of a sudden there's the young, sexy, hot Demi Moore drinking the Coca-Cola with her red, luscious lips. Watch that movie, you're gonna pay attention to that.
I will, I'm gonna go and watch it this weekend.
Yeah, and then the second thing that they show is the butt. The most powerful scene, the first scene when she transitions, is her standing naked in front of the mirror, looking at herself, but they don't show her face. They show her saggy butt. And then the next scene right after that is the young, hot Demi Moore with the round, big butt doing Pilates. And her butt is not the gross, Miami, crazy BBL. It's a sexy, nice, toned Pilates butt. That's what we want. We want that butt like you've been doing squats all day long. That is timeless, that's sexy. And that's Hollywood. I wasn't involved in making that movie, right? Yeah. Those are the two biggest symbols of youth and beauty, and that's it.
So how often do you have to come for like the butt lift? Like how does the procedure work?
Lasts 3 to 5 years. So
it lasts 3 to 5 years. So you come every 3 to 5 years.
Correct.
And get it. I mean, there'll be something new out there by then.
Every time I say there's something new, but yeah.
Now, you're really savvy on the business side too, right? I've seen like a lot of your videos and things like that. Talk to us about the money side of investing in beauty and aesthetics.
I tell people this, the best thing I ever did was take control of my life. And I invested a lot into myself early on. My whole journey into all of this started when I was in college, and I got cheated on by my girlfriend, and she cheated on me with my friend.
I'm sorry.
And no, it's okay. I mean, all our struggles make us better. I was a very firm believer in that. I don't believe in being the victim. I believe in literally, I'm grateful for this. But I remember I got cheated on, and I went by myself to the movies, and I saw a movie called Crazy Stupid Love. And Ryan Gosling, if you're listening, you literally changed my entire life. Like, I literally went to go watch that movie. And in it, it's about a guy who gets cheated on by his wife, and he's sitting at the bar drinking these vodka cranberries, he's moping and complaining. And Ryan Gosling's this really cool, sexy guy who's like dressed well, all the women are around him. And he sees the guy and he's like, hey, you need to take control of your manhood. He's like, you need to take control of your life. And he's like, I'm gonna help you, right? And he takes him shopping, and he gets him a good haircut, gets him to the gym, fixes his skincare. Remember there's a scene, he's like, change your skincare. Yeah. I literally watched that movie, and right then and there, I decided that day, I was like, I'm gonna take control of my life. I was like, I'm not gonna let life take control of me. I'm gonna take control of my life. I went that day, I bought new clothes. I started buying good skincare. I started changing my haircuts. I was a student, I have a lot of money at the time, but I put everything that I had and invested into myself. I invested everything into me, and I knew that I'm gonna take control of my life. If I had some money, I bought, and you know what? Buying new clothes, changing my appearance, it made me feel amazing. It taught me that I could take anything I don't like about myself and I can fix it. And anything I don't like in my life, I can take control. I don't have to be a victim to my life. I don't have to let life take control of me. I am in control of my destiny. And that's what that movie and that's what that experience taught me. And everything that I've ever wanted in my life, I know I can go and I can get it done. There's nothing I feel like
So
is
that
I'm in control.
investment paid off even in school, in career.
Everything. We make snap decisions about people. We are hardwired. I mean, this is proven science. We make snap decisions of people within milliseconds of meeting them. Based on, what's that based on? Nothing but your appearance, of course. Based on how you smell, based on how you look, based on your hair, based on everything. We make instant decisions about people. This has been proven over and over again through studies, right? So the most important thing I tell people, the most important thing you can do is invest in you. That's more important. There's no point in saving for anything else until this is your life. You need to live your life how you want to live. Don't let anything else. And I genuinely believe this to my core. Anything is possible in this world. Anything is possible. You dream it, you can have it.
Beautiful. Well, that is the philosophy we have at Sydenham. I mean, most of our members are young, they're healthy, they just want to be the best version of themselves. Yeah. We don't have a lot of sick patients who are just looking for the concierge service that come to us. For reactive care, they're coming to us because they really want to feel good on the inside. And then we partner with physicians like you and the top physicians in this community to make them really feel good on the outside, because we know that has an impact on the inside. Like, you want to comply with your supplement regime, or you want to make the lifestyle changes that we're recommending, because suddenly you feel beautiful on the outside.
100%. And you said something important, and this is something that I tell every single patient. You keep saying the word feel. And that is the most important thing of what I do. It's not about external appearance. No. It's about how you feel. And I give this example. You can be around someone, right? A man, he could be the most attractive, physically attractive man in the world. But if he's not confident, his energy off, all of a sudden you're like, ugh, like they're not attractive to you, right? But you could be around a man, maybe he's not so good looking, but he's so charismatic, he's so charming that they become attractive, right? And you're attracted to them, right? I've talked to every woman. They've all agreed with me. They've seen guys who are models who are like, ick. Yeah. But there are guys who are not so good looking, but they've got that charisma. And it works the same with women. Yeah. I met gorgeous girls who I see photos of, like, oh my God, like, as if I could only ever talk to them. And then I meet them and I get the ick because they're just like, something about their energy's off. Yeah. And I can meet women who are not so attractive, but they've just got it going on. They're so confident, they're so charming, they're so beautiful that, like, they become attractive and they become more attractive than the other person. So what I tell patients, that's why I say, again, the most important part of my consult is to hand them the mirror and say, what don't you like about yourself? Because if I can fix that and I can make you feel a certain way, that's what true sexiness. Sexiness comes from the inside. It comes from how you feel about yourself. Absolutely. So that's what all of this that we're doing is about. It's about making people feel amazing. It has nothing to do with looks. Looks is just something that is a byproduct of that.
Well, thank you, because a lot of people are swayed. The money is great because it's all cash pay. A lot of people are doing, there's a lot of competition around here. For you to differentiate yourself in this crowded market is hard. But I really feel that your focus on making them feel good and then not taking them down that whole insecurity road is really doing a great service in the beauty industry, where I feel like somewhere the standards are like quite in the gray area. But
100%. I think, my business is, I don't run a single ad.
Yeah.
Everything that we do is word of mouth. It's completely word of mouth. And to me, it's all about delivering the best possible experience and the best possible service and the best possible result to every single patient encounter, in the hopes that they're going to go and tell their friends. And that's how I run my entire business always. And actually that's what I learned from my mentor. The guy that I worked for before, I will say one thing that I learned that was amazing from him was that he was always very good about that. He didn't run ads. He always just said, every patient encounter, treat like it's the most important one of your life, because that's your opportunity to impact their entire group and treat everything like that. And he's like, you have no choice but to be successful.
I mean, that's exactly how we grew in Texas. It's all word of mouth. And really, we have 90% renewal rate. We have members who renew year after year. And that's the matrix we're tracking. Did we change their life? It was not like just a one and done, come get your testing and you don't renew the next year. It's like, come live your life with us. Absolutely. And that only comes from being truly authentic and caring about what they want, which is the approach you have. Absolutely. Well, now I'm going to jump into like our rapid fire section. We have a section called Hot or Not. And I know you have a lot of strong opinions.
I have a lot of strong opinions.
Wants to hear them all. The first one, you're big on filler. Really, is filler hot or not?
I don't think filler is hot.
Okay.
But I think it's again, it's unfortunate. I think there's a lot of misconceptions around filler. And I think filler, again, it's not my first choice for a lot of things, but in the right patient, it's an excellent one. Again, it's like salt. Like, I don't really like salt. I try not to eat salt, but sometimes you need a little salt, right?
Yeah.
Sometimes the food needs a little salt. So it just depends on, just like I said, metaphors. It depends on the dish, depends on the person, right? In the right person, filler can be excellent. In the wrong person, it can be terrible. So I don't think the answer is no filler, but I'm not like gung-ho about like putting filler in ever. It really just depends on the case.
Sculptra.
I don't like at all.
Not hot.
I don't like it. It's not that it's not hot, it's that it's expensive and you don't really see much. And like you have to do many rounds and then it's like you have to wait 3 months and you may or may not see results. And I'm not a huge fan. I've never really seen amazing results from it. So it's something that we can do, but it's not like my first choice.
Platelet-derived growth factor, PDGRF.
Strongly dislike.
Really?
We tried it. That's something that's, trendy right now that I think is actually really bad. I don't offer it at my clinic. I think it's really not good. I've seen, we tested it a little and I just was not impressed at all. And I think it actually can be quite harmful. I'm not a fan. I don't offer that to patients. And actually, I discourage patients from doing that.
Interesting. What about PRP and PRF?
Can be good in the right patient too. Mixed. So again, I'm not a huge fan of PRP, but it can be amazing. PRF is different. PRP, it depends for what. The problem with PRP that I have is you don't know what you're actually getting, right? We take the blood, we spin a centrifuge. The centrifuge separates the yellow from the red, right? The yellow is plasma, the red is red blood cells. When we take the yellow, we don't know how many platelets are in there. We call it platelet-rich plasma, but we have no idea how many platelets are in there. Who knows, right? So the problem is we don't know what you're getting. So can it be great? I've seen it be great, but I've also seen it do nothing. So PRP is not my first choice. PRF I like more because it's a great option for the eyes. Because it does provide some viscosity, it does fill, and especially for the patients who don't want.
Can you quickly explain what PRF is?
So PRF is a more platelet-rich fibrin. It's a more viscous, concentrated form of PRP that you can inject like a filler, but it's a natural filler. And I do like that one. I think that's something that I do like, and I find that for a lot of patients, for example, the eyes, right? If under eye filler is very tricky, and in a lot of patients, it's not a great option. So barring that, there's not a lot of great options for the under eyes that can really fill if you're hollow. So PRF is an amazing option for those patients if they're averse to filler and if they're not a good candidate for filler. So in those patients, PRF is phenomenal. I do like PRF.
Great. What's the verdict on Easy Gel, hot or not?
Easy Gel is PRF, yeah. So I love Easy Gel. Love.
Okay. Botox and neurotoxins.
Love. I mean, that's like it's a no-brainer. I mean, like there's a reason why it's the #1 treatment in the world. It's for a reason. Like even my friends were deathly afraid of Botox. Like all my guy friends are deathly afraid. I do it for them, and they all call me. They want more. They become, because you just see how good you look, and it's very natural when done correctly. The problem is, again, people do way too much. And I was at this dinner with all the Beverly Hills doctors. I got invited by one of the big toxin companies, and they sat us all down. They had all these famous plastic surgeons. I was like, oh, I got invited. I was like, this is nice. So we're sitting at this. I was on the table now. I was like, this is cool. And the first famous surgeon comes up, and he's like, he's very famous on TV, and everyone's like. And he's like, I do 200 units of Botox. And the next surgeon comes on, another super famous world surgeon, like, I do 150 units of Botox in the face. And they're all talking, oh yeah, I do 20 here and this. And I come up and I'm like, I do like 30 units. I don't know where everyone's getting 150 units. I was like, I do 30 units in my face. And I was like, my patients don't want, that look of being frozen is out. That look 10 years ago was like, don't move my face, so frozen. That's not natural. No. That's not good. I don't like that. I tell people, like, I have Botox in me now, but I can express. I'm not forming any wrinkles, right? But I can move my eyebrows. I can do everything. That to me is masterful Botox. Masterful work is when you can have full expression, but not form any wrinkles. That's the goal of great Botox. So you should be able to move your face. If you're frozen, you're not moving, that's not a good look.
My 21-year-old son is watching, and I'm sure he's going to want Botox tomorrow.
This is funny.
Salmon sperm facials.
Love. There's a reason why it's the #1 treatment in the most advanced country in the world. The most advanced country in the world for what we do is South Korea. Yeah. They are leaps and bounds ahead of everything, and this is their #1 injectable treatment, and it's done in millions of people worldwide. I first tried it on my face when I was there, and I was blown away. And I
There is some downtime to it. Can you explain to people how you do it?
So there's different ways of doing it. This is why you have to talk to your provider. The traditional way, the way that it's done worldwide, is manual injection. They do micro droplet injections all over the face, neck, wherever you want to do it. That's how it's traditionally done. A lot of people here like to do it microneedling. It's still good with microneedling, but that's not the way that it's intended to be done. The way that it's done worldwide on millions of people is the manual injection. That's the better way. Just 1 day of downtime. Realistically, you will have little bumps the day of. By the next day, they completely absorb. But this is some powerful stuff. I'm not kidding. Like, every time I do it.
How long do the results last?
And again, depends on what you're trying to do. If you're coming to me and you're saying, hey, I have horrible acne scars, you're gonna need more than one session, right? If you're coming with a severe problem, if you have a really bad cavity, one dental cleaning is not gonna cut it, right? So you're gonna need multiple treatments. If you're coming with a perfect face like yours, then maybe once every 6 months, right? Then we can do a little maintenance treatment.
Okay. What about at-home microneedling rollers, hot or not?
Don't like it. Don't do it. It's not that it's bad. Microneedling is great. It's that I've seen people scar themselves. I always say, if you're a trained, leave it to the trained professionals, right? Because I like to sew for fun as a hobby, and I trained as surgery. I like to sometimes, I experimented with sewing my own pants. I've destroyed like half of my wardrobe doing this. Like, so I had to be like, leave it to the professionals. You know what I mean? Like, leave it to like, when I need to get alterations done, I take it to the tailor. Don't do it at home. You know what I mean? Like, same thing with your face. Don't do it at home. Leave it to the professionals.
What about CO2 lasers, hot or not?
The best treatment ever. Best treatment ever. It is so hot.
All skin types? Because I know like Asians.
Nope. Actually, you'd be surprised. For Asian, depending on the type of Asian, I've had incredible results from my Asian patient. Actually, I had one of my Asian patients call me recently, and she was so scared. She's like, I heard you can't do it if you're Asian. I did it for her. She called me saying this is the best treatment she ever did in her life. And I feel that way. It does depend on the skin type, and I have to look at your skin in detail to say it's not for every skin type. But in the right skin type, there is nothing better than that treatment. That is the creme de la creme of treatments. I love it. When I do it on me, I get more compliments with that than with anything else.
Great.
And you can combine it with the salmon, and that gives even better results.
Before or after?
I mean,
like you first do the CO2 laser, you heal from it, and then you do the salmon, or you first do salmon?
Same time, all the same time, but the laser first. I never want to heat any injections. I don't do injections and then laser. I do laser first, and then I do the injections after. But you can do them at the same time, and the results are better if you do them together, actually.
Wow.
So it's cool. We do some cool stuff at our clinic.
I know, this is exciting. I have to. What about tropical hair treatments, like minoxidil?
I'm not a fan of the topical. The problem with the topical is that it's not like you just put it in your head, it just works, right? It's absorbed through the skin, get broken down by an enzyme. Well, they did a study where they biopsied a bunch of people's scalps and like, how much enzyme do we even have? And like half the population didn't even have enough enzyme for it to even work. So not to mention the topicals are annoying, they're greasy, they irritate the scalp, it's impossible to keep up with. The pill is way, way, way better. It's easier, it's better. We know from data that it's way more effective. I'm a huge fan of the oral versions, not the topical. I do them myself.
Okay, so which was my next question with oral hair treatments, but I think we spoke about it. You're very hot on it. Yeah. What about hair transplant? Is it hot or not?
It's hot, it's hot. Again, hair transplant, if you are an advanced case of hair loss, hair transplant is magical. What I tell every patient, what they need to understand is that hair transplant does not cure hair loss. Hair transplant merely moves hair from one place to another. And any good hair transplant surgeon will tell you they won't even operate on you unless you're doing the other stuff. Because I've seen people who spend a fortune on hair transplants and their hair falls out anyway because they're not doing the other stuff. Because hair transplant does not stop hair loss. You need to do something to stop the underlying hair loss. Yeah. That's where all these other treatments come in. But in the hair transplant, it's extraordinarily powerful treatment.
Great. Well, thank you so much for that. Before we wind up today's conversation, and I'm sure you're going to be back to talk to us all about the latest greatest treatments that you're pioneering in your Done by Dorfman. What is one health tip that you follow, and it's like a cool biohack that you practice for yourself?
I'm obsessed with the peptides. I think the peptides are the biggest revolution in medicine. I've been on it now for 5 months, and I am seeing changes in my body that I've never seen before. And my doctor actually was the first one who told me about it. And I didn't believe him at first. I thought, whatever. And then I had some patients tell me about this, and then they were swearing by it. And then I went to a medical conference, the Anti-Aging Medicine World Congress, and they had a whole day dedicated to it. And I'm like, okay, if all these doctors are doing it, I was like, let me give it a try. And I can say that this stuff is incredible. I mean, peptides are really the next revolution in medicine. And I tell anyone, you can do peptides for anything, but there's a lot of different ones. And I am such a big fan of them. And I just what I've seen has been absolutely
What are your top 3 peptides?
I love tesamorelin. Tesamorelin is an HGH analog. It helps your body produce its own HGH. And I can tell you, so for myself, I am burning more fat. I'm building more muscle. I'm lifting heavier, and I'm losing weight. I love the GLP-1s.
Right.
I love retatrutide. And I love tirzepatide. I think those are literally life-changing medications. I mean, the amount of people that are on them and how many people have had the results you can get with those they speak for themselves. I think those are amazing too. I like BPC 157. I think that's great for recovery and anti-inflammation. I like HCG. I like GHKCU, also good for hair and skin. A lot of different ones. I like, they're amazing. Amazing. I cannot speak highly enough about them.
So what is another biohacking trend that you feel is completely like not working, and it's just such a big fad, and yet like there's no evidence for us to follow that fad?
Oof, that's a hard question. I don't know. I mean, like, I only try to surround myself in my world of the things that I really like.
A beauty trend, which you feel like is a trend and does not deserve to be a trend.
Sometimes skincare is an interesting one, where I think there's a lot of products out there that do absolutely nothing, and that people spend a fortune on this stuff, right? Like, and then it doesn't do anything. The right skincare though can make a massive difference in your face, right? So there are certain things like retinol, for example, that makes a huge difference. Vitamin C serum, that can make a huge difference. Using a high quality, good moisturizer makes a difference versus not moisturizing. But sometimes I see these like enzyme things that I'm like, oh my God, like people are spending like $800 on this like skin caviar cream that like is never been proven to be any better than Vaseline, right? So I think it really just depends. Amazing medical grade skincare is amazing. A lot of times what people do is they go and they buy these like skin gold flake caviar crystal diamond moisturizer that's $10,000. It's total nonsense. But really good high quality medical grade skincare with actual good ingredients that are like niacinamide, retinol, vitamin C, these make a huge difference in your appearance. And we know from a lot of data that they're excellent. So I always tell patients, you gotta be using medical grade. If you're not using medical grade, you're paying for marketing. That's it.
Well, thank you. Thank you for that. And I think the biggest takeaway today is really, truly, health is our biggest asset. We have patients who luckily do have the disposable income to invest in themselves. But truly, this is an investment that is going to give you longevity if you invest in your outer beauty, your inner beauty, going to the root cause. And I think it's not about vanity. I think it goes way beyond. It's all about how you feel, how it makes 100%. You feel, and you make others feel good too. When you're feeling good, you make others feel. So I think we need to just change our perspective and look beyond Beverly Hills beauty, plastic surgery, and see that there could be a deeper meaning somewhere.
There's a massive deeper meaning. I mean, I had a patient, actually it was also a couple of weeks ago, who just got out of a really bad divorce. For past 2 decades, she was just been told how ugly she is by her husband and made to feel awful. And she's now divorced, and we did her treatments, and she started crying. I thought I was causing her pain. I'm like, are you okay? And she just said no. She said this is the first time she's done something for herself to make herself feel beautiful. After being in a 2-decade awful marriage where she was made to feel so ugly and so hideous. That's powerful. That's changing someone's life. To make them feel beautiful and feel amazing about themselves, that's life-changing. So that's what we like to do at our clinic.
Well, thank you for doing that, and thank you for being on our show. So until next time, please keep sending us questions. We would love to bring you more physicians, more conversations around health, wellness, longevity. So thank you so much for joining us on Ask Sid. So until next time, remember, health is by choice, not by chance. Thank you.